as we finish up our series on sciatica and how to treat it yourself, what we do here in the office, we're going to do a quick review of the anatomy before we show you one of the most common things we'll do here in the office to help decrease some of that muscle tension on the back side of that hip where that sciatic nerve courses through. So I did my best attempt to use kinesio tape to demonstrate the relationship between the piriformis and the sciatic nerve. So as that sciatic nerve comes out of the low back, dips down in the pelvis and pops out to shoot down the leg, for most people it'll actually come out from underneath that piriformis muscle. There's a small group of the population that'll actually come out over the top and come down, and then there's a very small 7 to 12% of the population that's very unlucky where this actually pops right through the piriformis and comes down. In that case, you're going to be well aware of it in your early years. You're going to have frequent bouts with sciatica because of that relationship with the piriformis. But when somebody comes in with sciatica into the office, the things that are going on with the low back are a little bit harder to manage, harder to directly impact. Typically, we'll do a lot of mobilization, some soft tissue release, even some dry needling in that area as we course down where that sciatic nerve would go to decrease some of the tension in the muscles while helping modulate some of that pain and decrease that for the patients that come through. But today I want to show you how we address the posterior hip. This is one of the most frequent things we do because we deal with a lot of runners, and there's a lot that goes on in this posterior hip that causes a lot of problems. But specifically with the sciatic nerve, we're going to address these muscles right here on the back side of the femur that are what we call the external rotators of the hip. So our goal with treatment here is to find some of the tender points, and typically we'll palpate through this area and find muscles that just feel like they have a trigger point or feel more dense than other areas of the muscle. And with that, we'll push into those and go through a range of motion in an attempt to stretch that muscle out from those tight trigger points. Part of the reason why we want to address this area back here is because of this relationship with the sciatic nerve. And it's also an area that we can directly impact immediately when somebody comes in with a lot of that shooting pain down the leg. We can most of the time take off a good amount of the pressure and decrease that intensity of that sciatic radiation by 40, 50, 60% sometimes, even when they do have a low back component associated with it as well. So anytime you come into the office for sciatica, we're going to be attacking the backside of this hip, as well as probably looking at the low back and doing some manipulation and soft tissue there, and then giving you some exercises to do at home. All right, so time for treatment of this area. Again, this is a really common procedure we do here in the office. It's what we call like a pin and stretch or a release, myofascial release of this muscle here. But what we're gonna do is find those dense spots, compress them, and work through a range of motion. Again, this can work for sciatic, it can work for running injuries. There's typically a lot of tightness on the backside here for most people because we all just sit too much. So what we do is we find where that piriformis comes off the greater trochanter, and again, that goes from the sacrum to the greater trochanter of the femur. Most of that tightness will be closer to the femur than it will the sacrum. We find a nice tight spot, we dig into it, and then we have the patient bring their knee up to their chest and work through a full range of motion. And I'm going to have Janae do a couple here, but as most patients can attest to, this is not the most comfortable thing we do. That's why we'll typically do maybe 10 to 15 passes on this. Okay, so that's typically what that looks like. We'll go through and look for different tight spots in the muscles, the surrounding muscles. You've got 6 external rotators back here, that 5 of which that support that piriformis. You've got the gemilli, the obturator internus, the quadratus femoris. Not to mention you're battling the glutes as well. So when you're looking at the musculature back here, it's something that we have to address when you're dealing with sciatica, even if the primary concern is coming from the low back and where those nerves exit the spine. So that's one of our treatment modalities we provide here in the office. If you have any questions, leave us a comment, give us a call, send us a message. Have a great day.